When does the child realize that something is wrong within his or her body? No, the child is incapable of doing it. So the mother, who is the best observer of the child, who almost always comes up with the complaints. The first physician who addresses the child's complaint will almost always be a pediatrician. So the primary complaints with which the mother brings the child to the pediatrician will be starting with sleep related breathing disorder. The mother observes that the child is not staying quiet on the bed while sleeping. The child keeps rolling from left to right, or sometimes even the child might get up from sleep, climb onto the mother and start sleeping. Sometimes the mother will observe the child has an extended neck while trying to breathe while sleeping. Also, whenever these positions are not being achieved properly by the child ends up having an added breath sound, which sounds like a snore. It may not always be a loud sound, but yes, there is a disordered breathing which causes that kind of an additional sound. Now, is this the only problem from which the child suffers with? No. Whenever this happens, the sleep is fragmented. The time during which the child should rest, recuperate, and rejuvenate is completely spoiled, the outcome of which is felt during the daytime activities. So now what happens when a child who is suffering from such a sleep-related breathing disorder is going to a school or playing on a field? Number one, the child has a hyperactivity disorder or lack of attention or focus on a particular thing. Number two, when it comes to sporting activities which will require exertion, labored breathing, the child finds it difficult to breathe and keep up with her classmates. Number three, the academic performance takes a beating. Now, most often than not, this is regarded as the child being mischievous or naughty at home, probably advised by the elders at home that things will be all right as the child grows up. We cannot completely complain that this is a wrong statement, because the root cause for this problem or the main culprit is enlarged adenoids and enlarged tonsils. Now, these two things are common. These are not disease conditions to start with. Any child up to the age of 8 years will have a slight amount of swelling when it comes to the adenoid and tonsillar tissue. However, when we examine the child, either endoscopically if the child is cooperating, if it's an older child, or if it's a younger child, when we do an X-ray lateral neck view, we observe that the posterior nasal airway is almost 90-95% blocked. Now that is a situation one should not be waiting to resolve by itself, because by the time the resolution starts happening, the child would have already suffered some irreversible changes. For example, older child with adenoids for many years will have something called as adenoid phases. What is an adenoid phases? Open mouth at all the time. You will also find overcrowding of the front teeth and a plastic expressionless face, and there is almost always a sniff or a snort. The child is trying to clear its nose and keep breathing continuously through her mouth. Now, we have to, as physicians and clinicians and surgeons, should be having a high index of suspicion and treat the child at the right time, so that the child has a normal childhood period, normal cognitive skills and intelligence growth, and a physical growth as well. Now, this is achieved by surgery. Primary treatment is almost always removal of adenoids and tonsils. Earlier classical methods, which are still in vogue, nothing wrong with it. However, the latest techniques which we follow, which is cobbler system as we call it, is relatively painless and bloodless. Most of the children can get back to normal food on the very same day or probably a day later. Resuming normal school, class or sporting activities can be done, say, in a week's time or 10 days time at best. Thank you.